Well, I want to welcome everybody to the Research in Quality of Care Interest Group. It feels like since forever. I'm just still there are people still arriving. Seems like forever since we've seen each other, and it might be forever before we see each other again in person. So um, GSA has made it possible for us to do this live meeting. Um, and hold on, let me admit the rest. It's more people. I got to keep clicking the thing. GSA has made it possible for us to do this live meeting, and I want to thank everybody for taking the time and to join us today in the middle of what everybody's busy schedule is. I'm going to turn to the first slide, which is our agenda, but I'm going to add an item, which is and you don't all have to answer at once. We could use the chat. I have the chat function open so you can send messages to everybody or just to me. And what I would like to know is, should this group, should we try to meet more often? I know we've had that conversation in past years at past GSAs. There's often interest in doing that, but not a lot of follow through. So one of the questions is, now that we're all working remote, the cost of having a meeting is now very low. So we can consider doing something that would be comparable to what we're doing today, which is something that this group has never really done outside of the GSA meeting. So just ponder that and think about, would you be interested, would there be value for you in having an off cycle, a meeting not at the GSA of this group? I am in other interest groups and other national organizations. I'm sure many people here are also, and there are other groups around related topics. So if we're all having our needs met, then that's fine. But if there's an opportunity to use this group to support each other, learn from each other, advance our careers, then we should do that. Why don't we take a couple minutes? We don't have a big group. We can go around and introduce ourselves very quickly, and then we'll get to the agenda. It's not very formal, as you could see up on the screen. So Jean, do you want to introduce yourself, and then we'll come back to you after the remembrances?
Sure. So I'm Jean Teresi, and I'm at Columbia University and also at the Hebrew Home in the Research Division that I direct. And I have been a member of Rescare since the very beginning, and I was a leader for a few years. I'm glad that Howard is doing it now.
Thank you.
So welcome, everybody.
And for people who are not aware, Jean is our benefactress, and in normal times, we have her to thank for a glass of wine, and her organization for a glass of wine and cheese and crackers. I'm just going to go around the screen as it looks to me and introduce everybody instead of people shouting out. So, Sienna.
Hi, everyone. I'm Sienna Caspar. I'm an associate professor at the University of Lethbridge in Alberta, Canada. And I've been a member of this group, I actually can't remember. I don't know how long, since before 2013, when I was nominated.
Great. Glenna?
Good morning, everyone. I am Glenna Brewster. I'm an assistant professor at Emory University in the School of Nursing. And I actually received the award in, I think it was 2017.
Andrea?
Hi, I'm Andrea Wysocki. I'm a senior researcher at Mathematica.
Oh, you gotta get out. Go on. Out.
Great.
Go.
Tara?
Hi, everyone. I'm Tara McMullen. I'm a technical advisor for the Centers for Medicare and Medicaid Services for Post-Acute and Long-Term Care, and I'm adjunct faculty at Georgetown University. And I have been with this group, I don't know, probably 4 or 5 years now, and I'm excited to meet with you all. Thank you.
Annika?
Hi, my name is Annika Backman, and I'm a postdoctoral researcher from Umeå University in Sweden. And I'm not a member of this interest group, but I am a convener of another interest group. So this is the first time that I participate in these discussions.
Which group are you convener for?
Systems research in long-term care.
Okay, great. Terry?
Hi, everyone. I have to take myself off mute. I'm Terry Moore. I've been sort of in and out of this group for a number of years. I cross over into other groups as well. I am a researcher in contract research, which I've done most of my career. I was at Apt Associates for a long time and now am at a small women-owned business called Insight Policy Research. Nice to be here.
Thank you. Nancy?
Hi, I'm Nancy Cosmall. I am an associate professor in social work at the University of Maryland, Baltimore County. I was also a health and aging policy fellow this year with CMS, with Tara, and with the Senate, looking at health and aging policy, nursing home policy.
Wow, exciting time to be in DC.
Yes. Back when we thought the impeachment was going to be the big news of our fellowship year.
Yes. Well, maybe you'll have, you can share some insight when we get to the open discussion.
Absolutely.
Paul.
Well, this is my first time here. This has popped up on my email, and I thought I would be interested in joining. I am a consultant. I help nursing homes develop training programs for their volunteers. And I'm also adjunct for the Department of Gerontology at the University of Nebraska. And my research is involved in volunteer impact on quality measures. We just completed a study. I'll be presenting a poster at the GSA, and then we're in the process now of applying for other grants.
Wonderful.
Oh,
wonderful. Nice to meet you. Jasmine.
Morning, everyone. My name is Jasmine Travers. I'm an assistant professor at New York University Roy Myers College of Nursing, and I was a 2018 Holmes awardee.
Wonderful. Deborah.
Good morning, everybody. I'm an associate professor at the School of Aging Studies at the University of South Florida and an affiliate faculty member in the Florida Policy Exchange Center on Aging, for which Dr. Kathy Heyer is the director of that center, our GSA president. And I'm not sure if she's on the call because I haven't seen who's on, but I have been in and out of this group for several years now, being involved in some of our pre-conference workshops, and I've convened the Hospice, Palliative, and End-of-Life Care Interest Group, active member of the Assisted Living Interest Group. And yesterday, for the first time, I participated in the Qualitative Research Interest Group, which was very active and lively. So I always enjoy the interest groups, as you know, Howard.
Excellent. Thank you, Deborah. Lisa.
I'm sorry, Liza, is that who you're?
I'm sorry, I apologize, Liza.
That's okay. I just wanted to make sure I wasn't the, you can call me anything you want, but I'm Liza Behrens. I'm a second postdoc at the University of Pennsylvania, and I've been in this group really for a couple of years now. My interest area is in person-centered care delivery in nursing homes, and I work in risk engagement and workforce development. And I'm actively looking for faculty positions. So just sort of putting that out there.
Liza, we are having a discussion on that topic in the Academy Health LTSS interest group. So if you're interested in that, that would be a good little crossover, little cross marketing. And Terry Moore is going to be on that panel. So she's nodding. Dylan.
Hello, everybody. My name is Dylan Jester. I'm a doctoral candidate at the School of Aging Studies, University of South Florida. This is actually my second year of being in this interest group, so I'm relatively new. Thank you for being so welcoming. And this is actually only my third year of being in GSA, so quite a new scholar here, but really excited to learn from all of you. Thank you so much.
Excellent. Lorraine.
Good morning. I'm Lorraine Phillips. I'm an associate professor at the University of Delaware. I've been here for going on 3 years. Before that, I was at the University of Missouri, which is really what got me started on quality of care in long-term care, where I worked with the quality of care team there. And now I serve on the Delaware Nursing Home Residents Quality of Care Commission, which is a governor appointed commission for the state. So I'm always interested to hear more about quality of care in long-term care.
Excellent. Terry?
So me, right?
Yes.
Yeah. So my name is Terry. I'm working as a research fellow at the Singapore Eye Research Institute. So it is now evening time for me. So I am interested in the quality of eye care delivery.
Thank you. There's somebody whose name is not appearing. I don't know who that is. We'll come back. Arthur?
Yes, good morning. I am a PhD candidate at UNT, University of North Texas. This is my first semester, first time in this group, so I'm just here to learn. My interest is in HIV/AIDS and aging, so I'm here to learn as much as I can.
Excellent. Gail?
Good morning. I'm Gail Towsley from University of Utah, College of Nursing and Gerontology Interdisciplinary Program. I don't remember exactly how long I've been in this group, but I think I kind of come and go depending on conflicts or non-conflicts or competing activities at GSA. So I'm happy to be here.
Excellent. We have one phone number. Is that you, Jean? 212-860-4399?
Yeah.
Okay. And then one person, one person whose name is not on the screen. Is that Lindsay Peterson?
Yes.
Hi. Okay, now there it is. Would you introduce yourself?
Hi. It's good to see everybody. I'm Lindsay Peterson. I'm with the School of Aging Studies at the University of South Florida, and I'm very happy to be here. I am fairly new to this group, and it's exciting to be able to see other people and talk to other people who also do research with nursing homes and assisted living communities.
Wonderful, thank you. So, so that's everybody who's at the meeting. Hopefully I didn't miss anybody. What I wanted to do just for a couple minutes is to give everybody an opportunity to offer some remembrances of dear colleagues who have passed away. This usually at GSA, there's a memorial service. I don't know if they're going to be having that this year now that it's virtual, but we've lost three very important people. I'll say a couple words, and if anybody wants to say anything, we'll take about 4 or 5 minutes and then move on. In reverse order, Carter Williams is someone that I never met, but obviously her work and her inspiration were always present in the work that I did as a graduate student, and and it really sort of undergirds, I think, a lot of the philosophy that's animated the work in this group. And I will leave it to others who might have a more personal remembrance of her. Helen Kivnick was not involved in this group, but her work on her work at University of Minnesota and her presence at GSA were just so important to me and to many, many other people in the field of social work and aging. She really was a wonderful human being, and she passed just recently. Of course, I worked very closely with Rosalie Kane for many years through graduate school and afterwards, and she was just a guiding star in terms of thinking about nursing homes and long-term care as places where people live, and not as hospitals where people are stuck forever. So it was very sad to lose Rosalie. I worked with Helen on a memorial editorial for the gerontologist that should be coming out soon. And then just as we finished the editing, Helen passed away. So it was very, personally, very difficult time for me. And I want to, with that, I just want to open it up to the group if anybody wants to offer a remembrance or some words.
Sure, this is Jean. I did know Carter Williams a little bit because, obviously she was, married to Franklin Williams, and we had some association with her some years back, doing some research in geriatrics at Columbia. And then, of course, I didn't know Helen, but Rosalie, of course, I knew very well, and she actually, when I was a younger woman, invited me to be on the editorial board of the Gerontologist, and she was very forceful. She came to rest care meetings for, just about every year since the beginning. And I have to tell you, Howard, I didn't even know that she had died. I was shocked when I saw this up here.
Oh.
When was that?
In the spring.
Yeah, in fact, there was a virtual memorial.
Yeah.
I attended her virtual memorial. That was right at the beginning of COVID, really.
Yeah.
When you could, it was that everybody had such great things to say about her. Knowing her as a researcher and a scholar, but the virtual memorial, her kids spoke, and I think one of her grandkids spoke, or a niece, and just getting to know her, more personally that way.
Yeah, this is Tara. When Rosalie passed, that was an active topic of discussion at Medicare, CMS, Medicare, Medicaid. That Rosalie helped build our nursing home program. We have Nursing Home Compare, but behind that is an initiative. And a lot of the measures that we still use today are kind of the thoughts behind them. Work never goes away, it just kind of goes in circles. And a lot of the work that Rosalie and Bob developed for Medicare is actually coming back now in the face of COVID. And so when she passed, a lot of people took note. It was sad for us because we were trying to bring her back, because we need these free thinkers, these visionaries, and these innovators in the federal government. And so she was definitely remembered by us feds, for sure.
Thank you, Tara.
Howard, I might also mention, Lauren Harris Kuchin from, she died this year.
Oh, no.
Yeah.
No, is
I
that?
didn't know that.
I didn't know that.
Yeah, that was
What?
It was about around the same time.
Oh,
Not in any of our newsletters? Oh my, I have so many fond memories.
Yeah, it's been in the assisted living, Cheryl Zimmerman had mentioned it.
Wow.
Oh, yeah, the National Center on Assisted Living group, Lindsay Schwartz group, had announced it it was around the same time as Rosalie.
Oh, that's horrible. Oh, I know.
Yeah, she's come to this group.
I had known she had been sick
With cancer, yeah,
for a long time.
Yeah. So I thought you'd want to know that.
It has been a very trying year. We just found out a colleague's passed this week, but then a colleague's parent passed of COVID, and it just feels like this year has been very heavy for a lot of people, a lot of disciplines. I did not know that about Lauren. It's very, very sad.
That is sad.
For me, Rosalie and Bob were really role models for both, their work, but also that they really embodied the work in their own lives, right? So I don't know if people remember that they started this, they had experiences with their own parents, right? Like in nursing homes and stuff. And they started this, I forget what the group was, but basically they were sharing, you know, experiences and trying to advocate for people in their own families. And then of course, you know, throughout our research community, you know, I think they were really trying to encourage us to be not just researching from afar, but actually really understanding what's happening on the ground and becoming advocates for the people who live in nursing homes. And that, you know, that is, she certainly influenced me in that way, she and Bob. And, you know, for those of you, I was just thinking, you know, there's a few people who are here who might be newer to this, you know, part of your career. You find these people who are doing great work and you sort of want to be like them, right? This is what she and her husband Bob were like, and for me, for sure. She was a force. I think that's what I said in my comments on the chat thing. She was a real force, but she will be sorely missed.
Thank you, Terry.
I'm just glad last GSA at this time last year, I got to sit and have coffee with her, and she'll just talk to you forever. She'll just like,
Yes.
neither of you have anywhere to be.
Right.
She was always that kind of person. It didn't matter who you were.
And Deborah, she always remembered people. That's
Yes.
the thing. You would meet her like once or twice and you'd be like, this person doesn't know who I am. Like, I don't, you know,
But
I
she
don't
did know
exist.
who you were.
But she knows who you are, or at
Yeah.
least who she associates you with people. Like, I know your boss, you know, and
Right.
that I'm really bad at that. So that's something that I noticed that I was like, I need to emulate that because that's really an important trait. And I
Well,
need
you
to
could-
emulate that.
You could just sit with her at a table at GSA and meet half of the conference.
Yeah.
Isn't that right? It's
Yeah.
true.
It is true. Yeah.
Well, Scott, just to finish that story, she had lost her phone
Which
or
time?
something.
Which time?
That same time I just saw her last year.
Which time did she lose her phone? Which
She
is
had me go try to help her find it. We went everywhere we walked. Back to her room. And
yeah. Excellent.
It was a nice lasting memory.
I don't want to cut this off, but I want to move on if we're before we get too sad. So what I want to do is I want to turn it over to Jean. Jean is going to introduce each of our Holmes awardees and ask each of you to say a few words about your research. And I have a video. Do you want to start with that, or do you want to save that?
No, I was gonna go in order. I thought we would end with Dorena.
Okay.
She was the last year's recipient.
Okay, so I have her video ready to go.
Okay, good. All right, so I'm just going to say a couple of quick words for those who are new. So one mission of ResCare is to promote research in quality of care across several LTSS settings. And the Douglas Holmes Emerging Scholar Paper Award is sponsored by ResCare and ESPO. And the idea is to recognize research with the potential to improve both quality of care and quality of life in these settings. And Doug was a psychologist, and he worked in the area of improving social services and also in technology and a lot of other areas. And the interesting thing is across the years, most of the awardees worked in areas that he had at least dabbled in. So that included, hospitalizations, caregiving, looking at service use among ethnically diverse older people, minority aging research, technology, and sleep consolidation in other areas of sleep. So really briefly, the first recipient of the award was back in 2011, and that was Callie Thomas. And I mention her because she is not here for a very good reason. She's on maternity leave, but she's now at Brown, and her mentors were ResCare members like Nick Castle and Vince Moore and Kathy Heyer and Rob Weech Maldonado. So I wish she were here, but maybe next year she'll be able to be with us in person. Okay, so the second awardee was Andrea Wysocki, and she is with us, and that was in 2012. And her talk was potentially preventable hospitalizations among elderly Medicaid home and community-based service users compared to nursing home residents. So Andrea, I'm just going to have you tell us what you're working on now and where you are, because I know you've moved.
Yeah, thank you. Yeah, so at the time of my award, I was also a postdoc fellow at Brown, so had some of the same great mentors that Kelly had, along with Bob and Rosalie Kane, have to mention them. So since completing my postdoc fellowship, I've started a position as a researcher in the health division at Mathematica. And Mathematica is a company that conducts different types of policy evaluation, quality measure, and data analytics work for federal and state government clients, foundations, and other partners. And since I've been at Mathematica, I primarily worked on federal government contracts, cutting across different types of work, including policy evaluations, quality measure development, and some primary research and analysis. And I work on projects across different Medicare and Medicaid policy areas, with a particular focus on beneficiaries who use long-term services and supports or other post-acute care. So just I can mention a few of the projects I've worked on here. I've worked on the Money Follows the Person demonstration evaluation, which has focused on moving participants out of institutions into community-based settings, receiving home and community-based care. Under a project for the Division of Quality at CMS, I led some development and testing of quality measures for Medicaid home and community-based service users. I've also worked on the Independence at Home evaluation, which is an ongoing demonstration program that the Center for Medicare and Medicaid Innovation is running for providers of Medicare home-based primary care. And then I've also recently led an evaluation of Medicaid managed long-term services and supports that examined a number of different outcomes across states. And currently I'm leading a contract for CMS where we produce annual reports on Medicaid LTSS expenditures and Medicaid Section 1915C expenditures. So have done a lot of work focused on long-term service users and really a primary focus on Medicaid users.
Okay, so thank you very much. And I just did want to tell you something. I was friends years ago, and a colleague, it does date me, but I'm going to say it anyway, with the founder of Mathematica, Tibor Fabian. So I don't even know if you knew who the founder was, but that he was, when he was over at Princeton. So just a little connection there. Okay, well, thank you very much for that update, Andrea. Okay, so the third recipient, let's see, Sienna, you're here, right? Sienna Casper. Yep, there you are. Okay, good. So the third recipient in 2013 was Sienna Casper, and she talked about the influence of organizational systems on information exchange in long-term care facilities, an ethnographic approach. And so without further ado, Sienna, I'm going to turn it over to you so that you can tell us what you're doing now and where you are.
All right. So that was actually from my PhD research. And from there, I went on to do a postdoc and a cross appointment at the University of Toronto and the University of Victoria. And in that capacity, I actually was able to do my own research as well and developed the responsive leadership intervention, where I went into long-term care facilities and helped to enable care team leaders to engage in responsive leadership so that they could empower and galvanize care aides or nursing assistants. because I really felt that that was going to be essential for transforming care practices. And then from there, I secured a position at the University of Lethbridge in the Faculty of Health Sciences, and was successful in early promotion and tenure. I'm an associate professor there now. And I've just continued to do intervention research in long-term care to try to have, and I predominantly have been doing participatory action research so that we can create change in real time in real places. And through that, I developed what's called it's a model for change that is all about galvanizing and empowering whole care teams together and enabling them to engage in collaborative decision making and to produce change that's actually feasible and sustainable and spreadable, both within their homes, but also then if it's a chain, then spreadable to other homes within that organization. And I just received funding, and we are about to package that, all of the education and training for that, into a website that then anyone can access for free, to be able to, because we've had amazing outcomes from this, like transforming care practices. And in one study, we actually were measuring care aides' moral distress, which is when they can't provide the type of care that they want to provide and know they should provide. And we were able to have amazing outcomes. But I can't go into every single long-term care facility. I can't be the one in there to help these organizations hopefully change. And so we're testing this now in 5 sites to see if the web-based education and training can produce the same types of outcomes that the in-person can. And it just was serendipitous in the most horrible way that this happened in the middle of COVID, when everything needs to be virtual, and trainings need to be accessible, and we need to have still interactive and engaging education trainings that are done virtual. So that study actually starts on October 22nd, and we'll be running it, and then seeing what needs to be done to, we'll be learning from them on what information needs to be added, adapted, or revised, and then we'll be launching it. And the Alzheimer's Society of Canada has set aside some funds to promote this website. So.
Well, thank you so much, Santa. I figured what we would do is we'll go through, and then I'm sure there may be at the end time for questions, because I bet you people have lots of questions for some of the presenters here today. So, but I figured we'd just, go through everybody first, if that's okay. Thank you very much, Santa. Okay, and then just briefly, I'm going to tell you who the 2014 winner was. Caitlin Rowland, and she works with Nina Chappell. She's at the University of Victoria in British Columbia, and she spoke about meaningful activity for persons with dementia. And I guess she was not able to join us today. And the 2015 winner, I can't locate Margaret Danilovich. I know she's at she's in physical therapy at Northwestern, but I really had trouble finding her. So if anybody knows where she is, let us know. But she had adapted a program on resistance exercise for home care settings, and it was really an interesting program. So anyway, now Glenna Brewster is here. So she was the winner in 2016. And she talked about determinants of daytime sleepiness in adults new to long-term services and supports. And at the time, she was at UPenn, and she was working with Mary Naylor, among others. So, Glenna, if you could tell us what you're doing now and where you are.
Sure. So yes, I was at Penn, a postdoc there when I received the award. And now I'm an assistant professor at Emory University in the Nell Hodson Woodruff School of Nursing. And my research now focuses on, and I guess back then, looking at sleep disturbances in caregivers of persons living with dementia and the persons living with dementia themselves. I did receive a research supplement. My mentor at Emory is Dr. Kenneth Hepburn. So he had an R01, so I received a research supplement to that intervention study. And I'm looking at qualitatively and quantitatively what the caregiver's sleep is like after they've participated in the intervention, and trying to find out more about whether or not the intervention had an impact on that. I also received a pilot study to do a dyadic intervention. So I'm doing a dyadic intervention. I received it from the Alzheimer's Association and a small amount also from the Guayzeta Alzheimer's Disease Research Center at Emory to do this dyadic cognitive behavioral therapy for insomnia intervention with persons living with mild dementia and their caregivers. So I'm testing it to see whether or not it's feasible, but also working on looking at adaptations. I'm in the process of resubmitting a K-23 that uses design thinking and human-centered approaches to develop a dyadic intervention also focused on sleep, but looking at outcomes of depressive symptoms and cognitive function in the dyad.
Thank you very much for that update. So in 2018, we're going to turn to Jasmine Travers, and she presented on a research project that she had. She adapted a conceptual model, which was it was sort of an advanced Anderson model to examine ethnically diverse groups in LTSS. And so, Jasmine, if you want to tell us about what you're doing now, that'd be great.
Thank you. So at that time, I was just transitioning from Penn in my first postdoc, also working with Mary Naylor, and went into a second postdoc at Yale with the National Clinician Scholars Program, which is focused on advancing health services research and developing leaders in the health services space. Currently, I just started at NYU, New York University, Rory Myers College of Nursing as an assistant professor in July 1st. With that start, I was able to be awarded a RWJF Harold Amos Medical Faculty Development Award, which is similar to a K Award, which provides funding and salary support and research support for 4 years. And for this award, I am continuing health services research methods using some large-scale data to understand differences in or disparities in quality measures among nursing home residents before CMS made some changes to the requirements that nursing homes need to meet in order to improve quality care, but trying to understand what that has done to disparities that Black and Latino older adults have experienced over the years. And so I'm working on that, and one of my mentors on that is actually Nick Castle, and he's been someone that I've been working with over a number of years. So that's been great to continue that relationship with him for this award. I've also been, very, very busy with kind of nursing home stuff throughout this COVID time, just because of all what's been going on, and it's been a tremendous opportunity to contribute to, really understanding how we can best meet the needs for older adults in these settings. I was recently awarded a Donahue Foundation Award to look at neighborhood socioeconomic disadvantage and how the disadvantage of a community affects nursing home resident outcomes. And I've just been able to expand my networks, which has been really great over the past couple of months outside of NYU. So that's just been a lot of fun with research and collaborating. Thank you.
Great, thank you so much. So let me ask you, Howard, do you want to actually play the video for Dorina now, or do you want to have some people ask questions of the presenters, or how would you like to do it?
Let me play the video, and then just a couple minutes for questions, but I put something in the chat so that we can handle anything that way. And then, Jean, if you want to make a plug for the Holmes Award for next year.
Sure. So I'll just briefly mention what Dorina was the winner last year. And, okay, go ahead. If you want to start it, that's fine.
Okay. Well, okay, finish what you were going to say.
Okay, I was just going to say that her talk was on change over time and daytime sleepiness among older adults receiving long-term services and supports. And she was at UPenn, and she still is. And so in this video, she talks a little bit about what she's doing.
Here we go.
I can't hear anything.
When you share your screen, you have to click the share the computer audio also. I learned that one yesterday.
Okay, let me see if who is the smart person who said that? Is that Terry?
Nancy.
Nancy, thanks, Nancy.
My name is Dorina Petrovsky, and I'm a postdoctoral research fellow at the University of Pennsylvania School of Nursing. I was last year's Douglas Holmes Award recipient, and that was really an exciting opportunity for me to come and present in front of the breast care interest group. The study that I focused on that was awarded the Holmes Award was looking at the changes in daytime sleepiness among older adults who are new to long-term services, care, and supports. And we ended up publishing this paper in the International Psychogeriatrics Journal earlier this year. When I was presented the award, that was really a highlight so far of my early career. So I think, again, the advisory committee, as well as those who reviewed my paper, that was really exciting. So currently I am in my third year of my postdoctoral fellowship in my last year. And so I'm currently transitioning, hopefully, to a faculty position at a university, and I just submitted a K-23, a Career Development Award, to the NIH earlier this week, and I'm really excited where my work is going to take me. My next step in my work is to develop a mobile application of tailored music for persons with dementia and their caregivers, and I hope to test this intervention with my K-23 from the NIH. So fingers crossed, it will get a good review and get funded. I'm sorry I'm unable to join you at the virtual meeting of the REST Care Group, but I'm excited to see where this interest group, what direction this interest group goes to in this virtual environment, and I'm sad to miss and meet other award recipients virtually. So I hope you have a great meeting, and I look forward to seeing the work of the members of this interest group develop over time. Thank you. Have a great day. My name is
Okay. I want to say thank you, Dorina, but it's awkward. Jean, you want to say a couple more things about the Holmes Award, and then we'll have a few minutes for some, or do you want to have some Q&A if there's any Q&A, and then Jean will say a couple things about the Holmes Award.
Sure.
Are there any questions for any of our presenters? It's okay if there's not. It's fine. Jean, do you want to make a pitch for the Holmes Award? I think many of our former awardees are in the position of mentoring and training students, and they should be aware of the opportunity for students to apply.
That's right. So, as obviously you're in a great position to know how to apply for this award, some of you, but there's actually, I should just say this, there's a $500 cash award that goes with it, which is sometimes helpful in defraying some of the costs of going to the meetings. It's basically for people who are doctoral students, postdocs, or 3 years out after their doctoral degree for an emerging scholars. And, you know, it's this, I believe, Howard, is on the website under awards and under ESPO. And perhaps, you know, we could send the link out later on so that everybody has it. But basically, as I said earlier, the idea is to promote research in, you know, quality of care, including quality of life across these LTSS settings. So in the past, people have looked across settings. They've looked at a topic across settings, or they may have focused on an intervention or something else within a LTSS setting. The other thing is many people have done secondary data analysis of large data sets. So there's a lot of opportunities for individuals who have different research projects and that may apply to this. So I suggest that you, if you have any mentees or you know of others who might be good recipients. I know Mary Naylor has been very effective because we funded at least 2 or 3 people who work with her. So I wish all of you would take a look at the website and the description of the award and promote some of your mentees to apply.
Thank you.
Howard, do you have anything more to say on that?
Or? No, I just want to mention that we're not going to award the Holmes Award this year. Not I think this is just an awkward GSA, and the award is out there. There's some structural challenges with the way it's promoted to people. I think people get the information about the award kind of late in the cycle. I think that makes it difficult, but there's really no way to change that except by using our professional networks to promote the award to our students, so that they know that it's coming up, and that gives them more lead time to work on their paper.
Howard, I'll just say just about that. I've been the membership committee chair for GSA this year, and we had a panel, a subcommittee who've been working on awards, GSA awards, and it's going to be better. we're restructuring a lot of how they're promoted, and they're reconfiguring the website. And now, how do you do it right now? Is it through a section or is it society-wide?
I think students who, if you're a student and when you submit your poster or paper, I think you have to self-identify as a student and say you want to be considered. And then I think you get an email saying with your acceptance, and then you have to submit the completed paper. The issue is that you don't get that invitation until after your paper is accepted. And it's only for papers, not posters. So people don't know. So like the way the calendar works, you submit your abstract in like February, March, you find out in July that you're going to have a paper in November. So that's not a lot of time from July to, and then the deadline for submitting the manuscript is like beginning of September, I think. So there's not a lot of time to actually have a paper in shape unless you already have a paper written. So, and that's very difficult to, I think, communicate to students back in February.
So it's only for accepted papers at GSA.
Yeah, and you need a full manuscript for this particular award.
And it can't be a poster?
No.
That's part, okay.
So the challenge is we want people who already have a paper that's in process to, you have to have your work already going in like January, or even the previous year, and then you're submitting to GSA for the fall of 2020. But you can't do a cold start in July. You have to have it already, in the works. So figuring out a way to promote it early, and also promote it, what as early as possible would be beneficial. Anyway, I don't want to take too much more time on that, but if you do have students that are working on papers, then that's great. I have a hard stop at about 11. So I wanted to see if we can spend a couple minutes on an open discussion. We had some kind of planning conversations for this meeting, and a couple of people on our group thought that an important topic, especially for this interest group, would be to really take a couple minutes to talk about what we're doing in terms of actually doing research or practice in long-term care in the time of COVID. And the idea was floated that there might be some people who would be interested in collaborating on an editorial to maybe identify some issues, concerns, best practices. So in the time remaining, I want to open it up to this topic. I mean, this is on everybody's minds. It's in the newspaper every day.
Well, Howard, this is Tara. Oops, I should start my camera. Apologies.
Okay.
I turned it off and I forgot to turn it on. This is Tara. So with Nancy Kusmal, who's on the call here, she's our fellow at CMS. And so I am the technical lead for quality measurement for nursing homes and post-acute care. So, we're steeped in COVID. And there's a lot going on behind the scenes with measurement around COVID and vaccinations, actually. And we have a nursing home data team that meets internally, and Nancy's a part of that team. And we've been talking about looking at some of the COVID data and looking at our MDS related data, and talking about pre-post, what's going on in terms of depression, what's going on in terms of other health related outcomes, mainly knowing that this sort of evidence really flexes and changes policy. And so if, talking, I think my interests always lie in, Nancy, pick up here if I'm leaving anything out, but I think understanding what we do as researchers, as gerontologists, how our evidence that we gather changes policy is really, really important. From the federal government perspective, I can tell you, we're just going like this. I mean, we're working 15-hour days, and I don't want to say we're making it up as we go. I think that's not right, but it's being developed in real time. And I have never developed measures in such a short, pick a measure, develop it in 1 week, and let's see if it works type work. Mm-hmm. So I think better understanding and advocating for in this group, everyone's evidence and how that could affect policy and the importance of that, and having our voices out there is really, really critical. And I think that also underpins a lot of the messages that you hear from GSA's policy group. I sit on those groups, and what you're hearing from PPAR, that, evidence really bridges that link to policy. And I think that's always a really good message to reinforce and help amplify, build, the path forward from there.
Tara, what do you think about the ICD-10 diagnostic information in the MDS? Do you think it's accurate, valid?
I think it depends on what you're looking at.
For COVID specifically.
I can tell you that we're developing our own administrative codes around that now, in that we're not sure how accurate it all is. But, something for this group, it's something to consider about coding practices, especially in nursing homes and the facilities across the nation. And I know Terry Moore is on this call and can speak to these things. I mean, I learned a lot of this from her, but especially in this public health emergency, there are lots of questions about the data coming out of the facilities. And, we've been working with the states to try to get the best data as possible. and we're running into, construct validity issues. So CMS, as they always do, ends up using the claim because, of course, you're going to get the most reliable data from the claim. I mean, people are going to bill to pay, to get paid. There are questions about those ICD codes, but ultimately in the MDS, I don't know. As you know, MDS was delayed for 2020. I don't know when it's coming out again, a newer update.
Mm-hmm.
This is the first time in me working at CMS for almost 9 years. I can't tell you, I don't know when it's coming out again, a newer version. So I would say like the ICD-10 codes, I know other countries are on 12 right now. They're great. But CMS is probably going to go fee for service route, billable on the claim for administrative data.
As a way to track COVID in nursing homes, you think?
Correct, specifically that and vaccinations. But as the world knows, CMS has worked with the CDC, and as of the last, Nancy, when was it? 2 months ago, we started putting our COVID data online. At least the CDC has. So we have real-time active COVID data. Of course, there's always a little lag, but now it's the next step of like, what about COVID? And that's where vaccinations are coming into play.
We've actually been at Insight, we've been producing those public use files, those COVID data. And that, as you said, sort of what's the quality of those data?
Yeah.
When you have a big stick, right, when you're going to tell nursing homes that if you don't report, you're going to get fined. So now it's a civil monetary penalty if you don't report those data. Of course, everyone's going to try to comply as fast as they can, but that stuff was a mess in the beginning. And I don't know, for me, Howard, you've done a bunch of stuff in sort of data and how data in nursing homes. Maybe we can get better electronic data. These COVID data were basically an extension of the NHSN, right? Yeah. It took this to get NHSN, used in nursing homes. I think we need to get a better infrastructure and not make it so hard. These people work so hard, and now they have this other reporting requirement where they're going to get dinged. And it's just, I don't know. It should be easier. It should be so much easier.
Yeah, I think there's a real, and I work very closely with the state of Pennsylvania Department of Human Services, and of the reporting that you're talking about, so it goes through Department of Health. So you've got this sort of split authority within the state, and they've got internal firewalls about these data. They call it NEDs. So there's this PA NEDs where they're supposed to report these events, and it's a totally parallel reporting system to the MDS. It's totally separate from the internal state licensure and quality management. So the data don't match.
Yeah.
They don't merge because they're not putting the provider IDs onto NEDs. They're just typing the name of their facility into the database. So
yeah.
And they type it differently every time.
Yeah. And
so it's crap.
With Georgetown, so I should probably speak from a Georgetown hat when I'm talking about CMS, but with Georgetown, under Pamela Saunders, she's our director. We actually had a Georgetown online virtual conference meeting about this. And one of the major things about policy and COVID is the fact that the data, how reliable are these data, but how do you match them up? How is this data usable? And the fact that there are, which rightfully there will be, so many efforts around collection routes. And where are we in a year and a half? Where are we with all this data? What does this teach us? And we actually link this to a greater cause, talking about how data should facilitate greater, this is actually going to Jasmine's work, greater improvements in terms of areas such as social determinants of health, how we should be convening another White House conference on aging, bringing people together and talking about when we are in public health emergencies and we have an older adult population, what do we do? How do we act? Where do we go? What can we do to make it better next time? And that was a really good session. And we actually wrote a manuscript from that, which we have not been able to get accepted yet, believe it or not. But this is a conversation that we should be having, because all of our research, I mean, everyone that I was listening to, everyone's research has a linkage into this issue. And I think data underpins everything that every single person on this call does, you know?
Tara, send your manuscript to me at Innovations on Aging.
Oh, okay, cool.
I am the section editor for LTSS.
Yes, they told us to send it to you.
Yes.
The gerontology. Okay.
Yeah, believe them.
Okay. Oh, I didn't doubt it. I didn't doubt it, Howard. I didn't mean it like that.
Thanks, everybody. I gotta run. Sorry to
Okay.
interrupt. Good to
Well,
see everybody.
Thank you. I'm sorry we just got onto the exciting stuff just at the very end. So what I want to do is make a placeholder to continue this conversation, and maybe we'll set up another meeting, because I really do want to hear what Tara and others have to say about this topic. And I was hoping to get into questions about doing actual field work in nursing homes during this time, but the questions around secondary data and administrative data quality are really, really important and complicated. So stay tuned, pay attention to GSA Connect, and maybe we'll do another meeting just on this topic.
Perfect. Thanks,
Yeah.
guys.
Thank you, everybody. And November, don't forget to go to the main conference. And the ResCare Interest Group is sponsoring 2 sessions. One is joint with assisted living. The other one is our own interest group symposium, sponsored symposium. And I know when the joint one is, it's the open discussion will be on Friday. The other one, I lost track of when that's actually going to be. So please look for ResCare sponsored symposia in the main conference. Thank you, everybody, and have a good day.
Thank you. Bye-bye.
Thanks,
Bye-bye.
everybody.
Thank you, Jean.
Thank you, Howard.